Now, for those of you who've seen my prior videos, you know that I don't have a lot of like for the physical therapy profession. And the way we practice today, can you actually blame me? The two reasons that I have such contempt for this profession today is one, and I'm speaking mainly in the outpatient clinics, but it also happens in other genres of physical therapy, is you continue to see multiple patients at a time, which is sham therapy. And two, you keep patients that can't be resolved and you keep taking them back over and over again. And honestly, if the world of physical therapy would solve these two issues, I would consider most of you colleagues. Because of right now, I don't. And it's completely justified why I don't. Now, I did a prior video on seeing multiple patients as a main problem in physical therapy. And today, I'm going to touch on seeing that continuous chronic pain patient. Now, when I talk about chronic pain, I'm not speaking of the general definition of chronic pain that we all learned in PT school. I'm talking about that continuous chronic pain patient. Patient that you call frequent flyer, the one you can't resolve, you know you can't resolve them, yet you continue to keep seeing them and continue to take them back months later, sometimes even a few weeks later with a new doctor's order. And that is what is making our profession ridiculous. And I've been waiting this quarter of a century for PTs to finally see the light with this nonsense, but I have a feeling the only thing that's going to make you change is when insurance companies come down and crush this profession. Now, many of you who weren't around in the 1990s think this can never happen. The fact is, it did happen when Medicare made severe cuts to this profession because we were abusing it and had been for a long, long time. And you know what? We're long overdue for it to happen again, and when it does, remember, most of you deserve it. Now, there's generally two types of patients that make up this continuous chronic pain patient. The first one may be a diagnosis. Lupus, polymyalgia rheumatica. These types of conditions have periodic flare-ups. And the fact is, there is nothing you can do during these flare-ups. Even though you think the physical therapy treatment is actually helping them, it actually isn't. The only thing that's going to help one of these flare-ups is when it finally recedes. Believe me, I've tried everything: stretching, strengthening, specific exercises. One philosophy even advocating using very low-grade spinal mobilizations to give a neurological effect and effort to reduce pain. And it did exactly squat too. And the doctors need to stop giving orders when these flare-ups occur, and you need to stop taking these patients back over and over again. But the second type of patient that falls into this continuous chronic pain category is the one that has it because of poor lifestyle, and this is the majority of these continuous chronic pain patients. It's due to obesity, sedentary lifestyle, chronic anxiety, or a combination of both. And there's nothing you can do about this type of patient either until the patient decides to change their life. I actually got in a debate with one therapist who stated, well, aren't we the best people to see about changing their life? Yes, physical therapy would be helpful, but when the patient doesn't listen, you stop seeing them. You don't keep taking them back over and over again. Because you know what? You can't solve obesity, you can't solve sedentary lifestyle, you can't solve someone's chronic anxiety. You can educate them, but this continual education every time they come in is ridiculous, and that's what makes your profession unethical. Because the vast majority of PTs out there are operating like this. You know it, and I know it. And this is a huge problem with me in the physical therapy profession, and this is why I have such contempt for it. Because it is the vast majority of you out there. Chronic pain has become a new cash cow in physical therapy. If insurance companies stopped reimbursing for it, this chronic continuous pain patient, half of the clinics out there would close. And you know what? You deserve it. Most of you deserve to stand in the unemployment line. Because when you spend years and decades not doing the right thing, you deserve whatever's coming to you. And the rebuttal I get from most PTs is, well, I'm solving my patients. No, you're not. You're not solving the continuous chronic pain patient. I had one physical therapist give me an example of a chronic pain patient that she, quote, solved. I asked her, did the patient change her lifestyle? Yes, the patient lost weight, the patient started exercising, got on a clean diet. There you go. You didn't solve anything. The change of lifestyle solved it. But if the patient hadn't changed the lifestyle, the therapist would have kept continuing to see her, accomplishing nothing except pillaging the insurance companies for money. And as I said, this type of continuous chronic repeat patient is becoming the patient in physical therapy as a norm. Never in this country have we been this obese, this sedentary. Never have we had in this country so much chronic anxiety and unhappiness. And actually, this is spreading throughout the entire world. The fact is, not only will the physical therapy profession not admit that they can't solve this continuous chronic pain patient, you're actually starting to have clinics that are engaging in maintenance therapy for these type of patients. These type of patients think physical therapy is their normal weekly routine. This sort of poor lifestyle is the root origin of fibromyalgia. Because never have I had a patient that was diagnosed with fibromyalgia who didn't have obesity, who didn't have sedentary lifestyle, who didn't have chronic anxiety, and it's usually a combination of the three. And if you look at these histories of the patient for these therapists who keep saying they're having an effect on them, one day they'll be 3 out of 10 pain, one day they'll be 5 out of 10 pain. One day they were walking their dog and the dog pulled the leash hard, so now they have 8 out of 10 pain. But the point is the pain is always there daily in these patients' lives because they can't be resolved. And you wonder why I call this profession delusional, because you keep telling me how you can resolve them. It isn't a bottomless well for reimbursement, but you think it is because once again, this is a profession that largely lives in delusion. And I'll give you 2 clear-cut examples of this type of delusion. One of them was in a clinic I took a permanent job with for a year in Wyoming. The therapist before me, who was also a director of the clinic, was seeing patients for 40 and 50 visits. These continuous chronic pain patients. She actually told her patients that they could keep coming as long as the insurance companies kept paying for it. And every time they would come back, literally a few weeks after they were discharged, she would give a slightly different diagnosis for basically the same pain location. The second example I had was in a clinic in Outpatient in Alaska. There was something like 5 or 6 patients that had been in physical therapy 8 or 9 months out of the last 3 to 5 years. I estimated that they had spent a couple $100,000 on physical therapy reimbursement to accomplish absolutely nothing. What did I do when I came to the clinic? I discharged all of them. Why? Because that's the ethical thing to do. And when I call you type of therapists out who are wasting a few $100,000 over a course of a couple years to accomplish absolutely nothing, then I'm the bad guy, right? Why do you have such contempt for the profession? Because the profession deserves it. Now, I'm not saying that you don't see these types of chronic pain patients. I'm saying that you don't keep seeing them over and over again. If a significant amount of time has gone by since I discharged them, I might take a look at them again to see if anything has significantly changed that I might be able to improve. What I won't do is keep seeing them repeatedly over and over again for pain complaints that can't be resolved, and neither should you. And now you're going to say, well, I have an MD order. What am I supposed to do? You don't actually follow the MD order if it isn't appropriate. If it's only been a week after I discharged them, I'm not even going to do a full evaluation. I'm going to bring them in for a consult. And when I find that's the exact same pain syndrome that I just discharged for, I'm going to write up that the patient isn't appropriate, we just discharged them, and I'm going to send it to the MD. Even if my discharge showed that some goals were resolved, I'm going to state that those goals aren't holding, and again, the patient can't be resolved. And I don't care if the MD gets mad. If the MD can't act like the adult in the room, then I'm going to overrule him or her. And that's exactly what the rest of you should be doing as well. And say it has been that 6 months since you saw the patient last time. I'm going to do a full evaluation. I'm going to take a look. I may even try again for a week or 2, but when it's not helping, I'm going to cut it short. I'm going to discharge him after a week or 2. And then I'm going to send it in my discharge again to the MD and tell him or her to stop writing orders. I'm going to tell that MD the patient cannot be resolved. Now, I know what a lot of you are going to say. Well, we've studied pain science. I know. I've studied pain science. Yes, I know the nerve fibers can chemically change with chronic anxiety, with chronic obesity, with chronic sedentary lifestyle. But it doesn't matter the why about the chronic pain if you can't solve it. That's the question. Can you solve it or not? And the fact is you can't. What do? You give some Pollyanna reasoning on why you're helping these patients when really you just aren't. And you're costing billions of dollars and you're causing everyone's rates to rise. So next time you're wondering why I'm out there making these videos, why I have such contempt for the profession, why I'm attacking all of you so much, My response for most of you, look in the mirror. Physical therapists, change the way you're doing things.